Welcome back. I'm Alfred Lamont Weber, and we have two very distinguished guests here today. Um, Charles Frohman, we have known for many years, and most recently, Charles brought us a very eye-opening webinar on the dangers of the impending 5G EMF health. Some people say danger, some people say challenge, some people say health genocide, okay? Because this is being rolled out worldwide with the great superpowers behind it. China with Huawei has gone 5G. Russia with Huawei has gone 5G. The United States of America with Donald J. Trump and the FCC have gone 5G without any testing. In Europe, the UK now, London Health England, as of yesterday, said there are no dangers to human health for 5G. By contrast, jurisdictions here and there of some note, for example, the state of Louisiana has now introduced a statute mandating that there be testing and evaluation of 5G before 5G can be rolled out there. The city of Mill Valley has banned 5G, so here and there are pockets of rationality. And Charles, when he comes on, will tell us more about his organization. And he's here with a distinguished lawyer, Ralph Fucitola, who is an advocate, a lawyer that helps companies dealing with natural products deal with harassment that they may face by either companies or by the infiltrated companies' representatives who sit as commissioners or staff of the FDA, because we know that the U.S. governments, as is the case with many governments around the world, have been infiltrated by the corporatocracy, the AI corporatocracy. So these two distinguished gentlemen will be speaking to us today about something that caught our attention, which is a new health plan. And for me, the great feature of it is that it covers both natural procedures, what we call alternative health procedures or natural health procedures, as well as allopathic. And I'm here in Canada, which, for whatever shade is thrown at it from various jurisdictions around the world, still one can find universal health care, and there are good faith physicians and good faith politicians that are attempting to deliver that here, but at the same time, it does not cover alternative treatments, and that even that is shrinking more. So that this plan that Charles and Ralph will be describing is only for the United States, but I feel that it could be a model for the world. So without any further ado, I'm turning it over to Charles and to Ralph to really get into the details of this. And Ralph, please tell us more about your overall umbrella organization and about this plan, which I think is a model for what can be offered around the world, where now those of us who are multidimensionally oriented realize that alternative healthcare is really, a way out of the prison of allopathic many times. Thank you.
Well, while I do myself as an advocate, I have to say I'm actually retired from practicing law. I'm happily retired. I practiced for 36 years. I guess that was enough practice. These days, I work through my vitaminconsultancy.com website, and I work with companies around the world on meeting regulatory requirements and presenting their ideas in ways that are safe and meaningful. I'm also president of the Institute for Health Research, which is an NGO founded in 1998. It specializes in working with people through IRBs and holistic, if you will, institutional review board, and we also have a journal where we publish things that don't get published in peer-reviewed journals. So I have a lot of involvement in this area, and I've worked with Frohman for many, many years, and I've been really impressed by the system that's been set up to bring health care alternatives to Americans. You know, we were faced with the prospect of nationalized health care in the United States through Obamacare, which in typical American fashion was imposed through a penalty and a tax. Well, it was a penalty, and then the Supreme Court said it was a tax, and ultimately the mandate got repealed, and we are left with utter confusion. One of the few groups that is cutting through that confusion are Charles's group, the Health Excellence Plus. I'm very impressed by it. It brings together different aspects of paying for health care that legally allows people to be in compliance with the American law and at the same time have access to health savings accounts and other modalities that allow them to actually pay for some of these natural alternatives. So I want to learn more myself as I hear from what he's going to tell us today. But I approach this from the viewpoint as a health freedom advocate. I work very closely with Natural Solutions Foundation and Dr. Lima Labo, MD, who's a fantastic advocate for health freedom as well. And, we want a healthcare system that lets us get alternatives and doesn't pay for vaccines. That's my ideal healthcare system. But anyway, I'd like to defer to Charles on the description of the several elements that come together to make Health Excellence Plus a viable reality.
Charles, you really, opened my mind to the possibilities that are out there to open we health consumers' ability to have access to natural health care and alternative health care, as well as the allopathic care. And that's something that is sorely needed, because I know that in my case and in many people's cases, alternative health care ranging from acupuncture to vitamin therapy to, many other forms of natural health care are becoming, in fact, the dominant form of health care. So what you are pioneering here is, I think, a very important model and development. So please lead us into your world.
Well, thank you, Alfred, and Ralph. Always good to see you. Let's first not explode the expectations here. We have a really good plan. Forbes magazine featured it as one of the best alternatives out there. But even as good as our plan is, and it's good, it really empowers patients and gives them choices. Ralph and the rest of us in the trenches know that those choices inevitably are going to be limited by the folks that have the power. And what do folks in power do? Well, Lord Acton said it corrupts them. And what do they do with the government that so many folks love? Well, they capture it. Regulatory capture. Important phrase that folks have to understand if they really want to understand politics. And that phrase means that however good intention you think a bureaucracy is, it's always going to do the bidding of the biggest donors. Definitely don't want to do just what's good for society or individuals, but what's good for them. So the Food and Drug Administration that Ralph has sued so many times over the decades, works for pharma. USDA, the ag department, works for big Monsanto, the agri companies. The FTC, that's allowing 5G without any studies or health concerns, this is controlled by big telecom. Financed by the big banks, et cetera, et cetera. And, I like to say as a libertarian that no matter how small I can shrink government, it's never going to work for me. It is always going to work for the powerful. So I always want to, tame people's expectations so that when I do describe our plan, you recognize that as good as it is, it doesn't absolve us from the responsibility to advocate for even more choices. So to answer your question about the plan, at yourfreedomhub.com, that website, you can learn how to empower yourself as a patient. And Ralph mentioned health savings accounts. That's what we give you so that you can save tax-free money for your out-of-pocket expenses. We have a new savings account featured also by Forbes magazine that builds money even faster than the money the bank will pay you in interest, so that you can have basically a doubling of your money to go pay for those natural therapies, Alfred, that you mentioned, the acupuncture, the chiropractor, the Christian Sciences, the other natural therapies. A lot of folks don't go enough to natural therapists because they lack the discretionary income. This new savings account, by doubling your money for like $140 a month, you can pay as low as $40 a month for a smaller account. But if you want to build like 10 grand over 3 years at $140 a month, you have a nice fat account from which you can withdraw funds to a prepaid Visa to go more regularly to that natural therapist. They need the money, they need the patients, and you need to go to these therapists because we are all sick. The chronic disease epidemic is because people aren't going to naturopaths and that like them, and they need to go to that. Now, increasingly, folks are doing that. They're getting the supplements, they're doing yoga, and that's all well and good. But that's what I want to say here, especially is that new HMA savings account that we offer. It's something most folks don't know about, but that's really going to give you the funds to become a more regular and consistent patient of these natural therapists. Now we have other parts to our plan that really empower you as a patient, for whether allopathic or natural. We give you teledoc, we give you a concierge shopper to help you shop around, for including medical tourism, and that's going to be important. Because as we get older and get cancer, Ralph, fewer and fewer of us are going to want to go to the chemo radiation stand. We're going to want to go to Chippewa Hospital in Tijuana, right? Or that harassed doctor in Houston, or any number of other places around the world, Thailand, India. And when you're paying cash, you can do that. There's no limit where you can go when you're paying cash. So we're going to help you shop around for drugs, testing centers, specialists, and that medical tourism piece, at least indirectly, is going to give you a lot of access to cutting-edge therapies, whether natural, whether integrated, whether using some immunotherapy route that CHIPSA is using for cancer. It's not really a vaccine, but I guess they're trying to stimulate some kind of response. I'm not a doctor, so. But the point is, we're empowering you as a cash patient. You're going to educate yourself. You're going to go to Dr. Google. You're going to ask around. You're going to explore. This is going to open up the supply. And the empowering of patients improves the demand side. Every market needs a supply and demand curve, or you can't have a market. You can't have big insurance or big government fix a market. You have to have a free market with supply and demand with price as a signal to facilitate shopping. That's how you get freedom. And it goes back to our earlier conversation, Alfred, about property rights. It's not just something for the individual, but also for native groups, to assert your right to control your destiny in your immediate area.
Well, there's another way in which the insurance companies interface with this in a very destructive manner. And something that I think bring up as part of the discussion. It's called insurance industry coding. If the doctor doesn't have a code for the therapy is not going to be provided because there's no way to pay for it. And if the code does not exist, there's no way to track the effectiveness of the therapy. And so there's a feedback loop a negative feedback loop between the failure of the insurance industry to provide codes for alternative therapies and the inability of the alternative physicians and practitioners to provide proof that those therapies work. And what you're doing by breaking open the whole insurance paradigm is to I hope loosen that up and allow organizations that are now trying to create codes. There's a group called abccode.com, for example, that are trying to establish codes. Remember, the AMA actually has a semi-monopoly on insurance codes, and if it doesn't include it in the code, it's not a therapy. And so that's a really important element as to how the insurance industry restricts access to the very therapies that would reduce the insurance industry's costs, as crazy as it is. So yes.
And that goes for government systems too. Keep in mind, the biggest Medicare providers in America are the Blue Cross knockoffs, United Healthcare and the like. And if everyone got Medicare in America, it would be government nominally, but it would be operated by these big insurance companies who would have the contracts operate these companies. So whether government or insurance, this big institution using coding to bring efficiencies to their process. So we create cash payers, and paying cash is how you get rid of the codes. You already have standalone surgical centers all over America and in Canada. Rand Paul, the senator from Kentucky that was trained, just went to Canada for a hernia operation. Why? Because in Canada, you do have private health care, and it's growing. And so you could start a high-level surgical center anywhere, charge prices, and attract business. In fact, that's the future. You're going to have these underserved rural hospitals specializing to attract tourism, interstate, over the border. Canada's going to go up there. Mexico is loaded with high-level centers all along the border. All those rich retirees in Tucson, Arizona go to Nogales across the border for cheap health care that's just as good or better. My aunts in Austin go to Yucatan for teeth work. We mentioned Chipsa Hospital in Tijuana. The Gerson therapy, Ralph, I think, is also located in Tijuana.
Oh, yeah, absolutely.
So
these are very real alternatives. And by the way, that insurance coding monopoly is based on contracts with Medicare and with other government agencies. So it's all linked together into a system of control, which is preventing us from exercising our right to freedom of choice in healthcare.
Right. So Medicare diagnostic related groups created the fake pricing, which trickles down to the big insurance companies. Everyone uses it. And then the medical boards use compliance with it to drum out maverick docs.
Yeah.
And, you need maverick doctors because medicine is an art, not just a science. Think of that TV series a decade ago, House. You want doctors experimenting with their brain power experience to figure things out. So the cash-based surgical centers, the other alternative centers opening around the world, when you can create a real price that's not based on coding, then you can you can restore the doctor-patient relationship. Now they're not like this churning you through to get their coded-based reimbursement. They're going to give you a couple hours. And these new direct primary care practices are charging a cash price. There's no rush. It's going to restore calmness, peace, it's going to cut down prices. Yeah, and so the 5G thing you brought up earlier, all politics affects your health because politics is violence. Basically with regulation, you shrink the pie of every market. It becomes an oligopoly. And a fight over a shrinking pie becomes win-lose. In free markets, it's win-win. Because then no one's persecuting you for making whatever choice you want. And there's always the court, right, Ralph, to adjudicate disputes, which are basically privatized through contractual alternative dispute resolution provisions. So, people need to think more openly about markets as a way to bring peace and alternatives that you want. And it's always comforting me when I talk to my fellow yogis, most of them are progressive, when they kind of grok this idea that coercion isn't your friend. You could Google liberty in the Vedas, and you can find libertarianism in the Vedas. You can find it in Lao Tzu, Taoism in China. You can find it in the Bible. What was it, Ralph? The Israelites go to Yahweh going, "We want a king," and God says, "Are you crazy? The king is going to just hack you to death and kill your kids in the army.
Right.
Don't be an idiot. Keep your judges." So, this is the most ancient philosophy of humankind. It is the natural philosophy without putting too much thought into it. You're born, you have a life, you want to make what you will of it, and healthcare is an important part of this discussion because it is such an oligarchy, it's such a cartel in every country. Because every country has government healthcare. And it's always, Hayek's fatal conceit. You've got some smart people over the decisions of millions of individuals, which, as Mises and Hayek taught us, are ineffable. You can't describe someone's preferences. You shouldn't have to. That corners you into defending what you want to do. No, it's no one's business. Your proclivities should be ineffable and innumerable. So I've got my health savings account. I'm paying cash. I'm using a sharing company to pay the big bills, not insurance. This is how you restore freedom. This is how you get the doctors to come back to the patient as a partner instead of a bully. Ralph mentioned the vaccine. So many pediatricians now are bullies, buying into this mandate crap. You can't have mandates mixing with informed consent. That's impossible.
Very quickly, we are faced with the point right now where either you stand for informed consent, or you're standing in the docket at Nuremberg with the Nazi doctors. That's the choice we're faced with right now, and it is horrendous. I just posted an article on open source truth. By the way, folks, opensourcetruth.com, very important spot to get information from. I just posted an article there about the persecution of vaccine conscientious objectors, focusing in on what's going on in New York State in the attack on the Orthodox Jewish community there, and we are seeing some very ugly developments, which require people to be very forthright and very demanding of their rights. Unless you assert your right to informed consent, the right to informed consent will be deemed waived. In the waning days of the Obama administration, several executive orders were issued and several laws were passed that have very dangerous implications for our rights. One of them was called the 21st Century Cures Act, which, among other things, said curiously that in the event of more than 5,000 people are involved in an experiment, a FDA-approved health experiment, written informed consents are not necessary. That leads the way to mass experimentation on the public without consent. That violates the Nuremberg Code, violates the Geneva Conventions, and is literally a crime against humanity. So unless you assert that right, it is going to be ignored. And we've tried to help people assert the right by creating something called the Advanced Vaccine Directive card. Just like some people carry a card in their wallet that says, "I am a diabetic," or a card that might say, "I refuse all transfusions," we have a card that says, "I refuse all vaccines. I do not consent to vaccination." And the card is available at this following link. It's tinyurl.com/AVD card. That's tinyurl.com/AVD card. Case law is clear. As recently as 2013, there was a case that I think is worth mentioning in this context. The case of McNeely, of Missouri versus McNeely. Mr. McNeely had a one-car accident and got rushed to the emergency room. And as he's being wheeled in to the emergency room on a gurney with an orderly on one side of him and a police officer on the other side, the police officer is saying to the orderly, "I want you to get his blood. I want to find out how much alcohol he's got. You got to get his blood right away." McNeely says, and I assume in a slurred voice, "Don't take my blood. I don't consent." Well, they took his blood, They arrested him for drunken driving and convicted him for drunk driving, and somehow his case got to the U.S. Supreme Court. That itself might be a really interesting something for someone who's an investigative journalist to figure out how that happened. But it got to the Supreme Court. The Supreme Court said, the officer could have called a judge and gotten a warrant to take the blood within moments. But he didn't do it. And Mr. McNeely said, I do not consent. And therefore, the taking of the blood was illegal. Supreme Court said, we have never wavered from our position that you have a protected privacy interest in preventing an agent of the state from piercing the skin. Now, this wasn't a vaccine case, but I don't know if you can pierce the skin. You cannot pierce the skin to take blood out. You can pierce it to put poisons in it. I think it's pretty clear on the issue. So that's an example of the interaction between the legal system and our right to make those free choices about healthcare. Go ahead, Charlie. I'm sure you have. You were talking about, and I interrupted you, so my apologies.
No, it's good to have the back and forth. And Alfred, if you have any questions, insert yourself too. But I was going to say, it's not just about vaccines or natural care when it comes to one giant experiment, because I used to lobby for an allopathic pharma group regarding pain medicine, opioids.
Right.
The late Siobhan Reynolds with the Pain Relief Organization represented pain doctors who give lots and lots of opioids because it's kind of natural. Opioids come from the poppy plant, which for 2,000 years, going back to Egypt, has been the plant to give you the medicine for pain. And when you're in long-term searing pain and your spine isn't secreting the endorphins enough to stop your pain, you're writhing. You've got to have your opioids. And now the doctors have a big target on their back from the Drug Enforcement Administration, throwing them in a cage, kingpins, if they give you enough opioids to relieve your pain. So there are millions of people out there who can't get enough opioids from the doctors and are going and sit on the streets for heroin and fentanyl and are overdosing. In some cases, you have some stupid kids mixing opioids with alcohol and they're dying from polydrug abuse. But by and large, real pain patients use opioids as directed, as a prescription, and they're fine. But the problem is, it is such an easily demagogued issue, the war on pain patients. And so that's another horrible aspect of our healthcare system, the bullying docs and the ignorance of the risks of these shots, the heavy-handedness of licensing boards against maverick doctors, the persecution by the FDA of natural therapists and people who tell you the truth about the health benefits of natural therapies. The vulnerability we have to this international food trade regulator under the UN called Codex that Ralph has had a lot of experience with, that is going to top the potency of our nutrients or slip in dangerous toxins that the EPA and FDA otherwise would forbid.
Right.
So many big issues.
They set the daily limit on all of the nutrients, the daily value, just below the level you need for health, just below the amount of vitamin C you need to avoid scurvy, just below the amount of calcium you need for bone health. But the level of allowed fluoride is 4 grams, something crazy like that. Yes, you're right about that one. That's for sure.
Yeah, and then with 5G, you can't, from the 96 Telecom Act, use health concerns to stop deployment of these disguised 5G towers, or who knows what's going to put SpaceX into those skies with satellites, the fluoride in the water. So many of these issues, not directly health related, are health related indirectly. And going back to even general property rights or other issues, all of it affects your health. Because whenever you allow regulations and demagogues to promise to save you from dangerous others, you oligopolize markets inevitably, and that creates warfare among interests for a shrinking pie. It creates a win-lose dynamic. It affects your health, your stress. So politics is part of health. Health is part of politics. I happen to have a private company that's empowering folks in a great way that brings peace and health. Ralph has had a great history of defense of innovative natural practitioners, and he still is a leader in advocacy to bring himself. Alfred hasn't told you about his background in so many areas of life that are full, including a health center at the border with Mexico. Tell us a bit more about that and how it affected your opinion of healthcare, because health centers are an important part of healthcare.
Yeah, well, I was in the 1990s and an administrator of an award-winning community health center at the border with Mexico and Texas, in Brownsville, Texas, and overseeing 20 physicians, 120 nurses, and 90,000 patient encounters a year. And this was, of course, 95% on Hispanic patients, and that's because that Lower Rio Grande Valley basin, which is on both sides of the Lower Rio Grande Valley estuary, has been that way for millennia, going back to the Aztec Empire and predating the United States of America, the Republic of Texas, and the various wars that occurred, whereby the United States of America absorbed that cultural, indigenous cultural area into its base and made it subjugated to the white settler population. So it's a very, and I led groups on both sides of the border, and now you have a militarization of the border and genocidization of Central America by the CIA, going back to the Contras, going back to doping, to the drug trade, which is led by the Bilderbergers, by the British Crown, and the absolute demolishing of the Ejido system, which was the Mexican traditional agriculture, through NAFTA, which was basically Bilderberger industrialization. And so that's what we're living now, and based on oppression by promoting duality consciousness racism to motivate military occupation policies. So what I understand from the consciousness of the border, which the populations there have an inherent cultural memory that predates the United States. I mean, the families there go back generations, and it's like they're just enduring generation after decade after decade of oppression from the globalist policies that are rolled out there. So the sooner that we can use people-oriented policies, such as you're proposing, that depend on the individual, we have to look at what Hayek was saying, and at the same time integrate it with humanistic policies as we begin to throw off these globalistic matrix policies. I mean, without even getting into the exopolitical aspects of it, and the Greada treaties that were signed by Roosevelt, by Eisenhower, by George H.W. Bush with the various interdimensional reptilian populations leading to the culture that we have now.
Through executive orders very often.
Yeah.
But interestingly enough, it sometimes works both ways. I've been very interested in an executive order from Trump, which set up the Division of Conscience within the Health and Human Services Department.
Tell us about that.
That is a very interesting development. Jeff Sessions, while he was still Attorney General, issued an Attorney General's opinion, which basically said that because of the Religious Freedom Restoration Act, which was adopted in the 1990s, which, by the way, is still courts held only applies to the federal government and people who get federal money, not directly to the state governments, but everybody gets federal money, so you know. He said that it's not enough that religious liberty is not just about expressing your beliefs, it's about living them as well. And government policies, which appear to be neutral toward religion, can often be detrimental towards freedom of religion and towards the establishment of religion. Of course, First Amendment freedoms, our First Amendment freedoms. But the founders were very careful when they put together the First Amendment. It brought together not just freedom of religion and freedom of the press, freedom of speech, but also the right to assemble and the right to petition government for redress of grievances. Together, those are our sovereignty rights. That combination the Supreme Court has called expressive association. And what's happened is the law that was adopted in the mid-90s, the Religious Freedom Restoration Act, says in its preamble, as I just quoted, that actions of government that appear to be neutral to your First Amendment rights actually may not be. And if they aren't, you have a right in any court proceeding, whether you're plaintiff or defendant, to raise that issue and have the courts protect those rights. And now it's being applied not just in the area of people who have religious objections to providing certain types of healthcare services, but it's also being applied in the area of vaccination mandates and in the area of other types of healthcare mandates that are being foisted on people. So I think it's an area that's of great power. The Sessions said it's not just enough to be able to speak your beliefs. You have to be able to live them as well. And we'll see how this agency, can we trust government agencies to actually protect us? I don't know. But we'll see how this agency works out. I have been urging people, including the people in the Jewish community in New York State who've been targeted, to go to the feds. If the state government is targeting you, do what people have done for 100 years and see if you can go to a higher authority. And that, I think, is a very interesting development that bears watching over the next number of months. I've written about that again also at opensourcetruth.com.
Right. So, Charles, how do you see all of this evolving? I mean, you've mentioned the Native American, the indigenous American involvement in this, which I would enumerate not only the Native American communities, the Lakota and the other nations
Right.
that are sovereign nations, and that are now recovering their sovereignty and their access to their culture after several centuries of, I would say, much more than benign neglect, in fact, active genocide by the federal government.
They were being protected by the federal government, weren't they?
I'm sorry?
They were being protected by the federal government.
The native tribes?
Right, protected to almost extinction.
Yeah. you're being ironic, right?
Well, yeah. I mean, the federal government spent a lot of money on the American Indian tribes. 95% of it went to federal bureaucrats. That sort of thing.
Yeah.
Yes. And it's only in America where we could bring justice to the native people by letting them have casinos.
Yeah, and sorry, I just want to finish this, but I actually met the vice presidential candidate of Russell
Yeah.
Means of
Oh, yes. Wonderful.
yeah,
Powerful.
yeah, and I know here in Canada the First Nations, many of them have not ceded their territory through treaties to the federal government. So you have vast areas here that are still subject to competing claims by the British Crown, by the government of Canada, and by the First Nation indigenous treaties simultaneously in the U.S. I would submit that you're going to have many of the American indigenous nations reassert their rights over sovereign lands.
Ralph, what Alfred's getting at is before he came on, after he discussed his role working in the health center for those border area Mexicans and the whole story about losing their traditional agricultural lifestyle because of the international pressure and exploitation. Yeah, I was mentioning our stand-on libertarian argument of property rights being a solution. And it's unfortunate that the phrase property rights has been pigeonholed, I think on purpose, to be just sort of another tool of the powerful to exploit the masses.
Right.
And in fact, as Walter Means touted when he was running with Ron Paul in the '88 presidential race, and later with the Lakota Project, property rights is the way to restore your ownership over your area and yourself, and to protect yourself from arbitrary government controlled by the powerful. And it's something that environmentalists in the liberty area have been talking about for the natives in the Amazon basin to protect resources from being overgrazed. And when you have a native group owning a huge swath of land, they're going to sell trees to pay for it. They're going to sell mining rights, but they're going to do it like any owner of property in a way that's sustainable. Because you don't want to overgraze or overcut, clear cut, because then you don't have any money-making opportunity next year. So what has happened, whether it's paper companies or nature conservancy or tribes, when they get a chance to really own their land and property rights, they make the resources sustainable. People have to realize that. There's evidence behind that. Mary Ruwart talked about it in her classic Healing Our World. But what you said about the Mexican farmers, Alfred, reminded me of those communist fascists in Russia who killed all the kulak peasants, right, Ralph? Didn't all those small farmers that were killed in the famine, were they private farmers? And it's kind of dynamic worldwide. You have small private farmers wiped off the map by bigger interests because they're in the way, right?
And it's followed by famine.
Yeah. So, I see property rights, as bad as that phrase sounds to some, as one of the key areas to regain your space, your peace. There are provisions, powers in the Constitution which are just recipes for crony abuse, like takings, the Fifth Amendment takings clause. There are decisions like the Kelo decision. Corporations use governments and these little tiny phrases of power to exploit the masses. So I always tell people, see government and corporations as one and the same. They're always in cahoots. it's not government or corporations. They combine to exploit you. I mean,
Well,
your
corporations
protection
are
is
creatures of the government. You know, it's, that form of structure and organization only exists because of a grant of the corporate privilege. You know, that, which is why, of course, when we talk about Yahoo and Facebook and the other censorers of our speech, they may be private companies, but they're not private actors. And we haven't learned the distinction yet between a private company and a private actor. And these companies, these creatures of the corporate state, are themselves highly tied into the NSA and the CIA through various contracts, and they really are acting under color of law. And when they censor speech, when they ban people, for example, Mike Adams, the health ranger, was just banned from Facebook for something he didn't post on Facebook, by the way.
Right.
Of course, Alex Jones not only has been banned, but they said they're going to ban anyone's mention of Alex Jones unless the mentioning of Alex Jones is critical. So these censors, privatized tyranny, as I call it, need to be brought to heel. If they're going to exercise the corporate privilege, then they have to also abide by the First Amendment and be neutral providers of a public utility without attempting to enforce their views on the people who are using their services. And I believe that that's an area in which libertarians are going to have a lot of dispute and discussion over the next few years, and whether there are those who will say, "Oh, they're private companies who should be allowed to do what they want," and there are others like myself who say they're not private actors, even though they may be private companies. I'm going to be discussing some of that later this year. In September, for the first time in 20 years, there's a Libertarian Scholars Conference being held. They were a regular almost yearly event in the 1990s and 80s, and now they're being revised. And the first one will be held in New York City in September, and I've been asked to present a paper on informed consent, which is a key element that fits into all the rest of this. Because, of course, by censoring our speech, by censoring what we can tell people about natural means to healing, for example, they are preventing us from getting the informed part of informed consent.
Yeah. Could I jump in here? And of course, and I have a number of directions I'd like to ask you about, but this conversation, I think, is extremely important because of the issues that you just raised, because it does seem to me that what you just mentioned, that we have these tech giants and the telecommunications companies, which are also tech giants, that are suddenly in a way implementing what we've called the transhumanist agenda, and that is in a way moving toward the extinction of what we call Homo sapiens, or the human race, because the First Amendment really is protecting what we acknowledge to be human, and that is that our divine soul, our divine opinion, our sovereign humanity, because it protects our relationship to our what we conceive of our spiritual creator, and also what we conceive of as our biological and social health and integrity. And so the issues that you raised today in terms of the health plans, but also in terms of the First Amendment protections vis-a-vis these tech giants, and I really appreciate the distinctions that you've just made, and also the 5G issues. It seems that this is the most crucial issue facing not only Americans but the world, because we're looking at human extinction here, or human hybridization into an AI hybrid race.
Right.
And so it seems that the issue of policymaking embodying these, shall we call it, libertarian principles, etc. Who is going to be the 2020 presidential candidate of the Libertarian Party, who's going to win the presidency and turn this all around, okay? And really keep the fire going. Who are going to be the libertarian mayors? Who are going to be the libertarian city council people? Who are going to be the libertarian-minded citizens who are going to stand up and bring the laws banning 5G to the city councils? Who are going to be, there's only one, well, you got 20 Democratic candidates, and now,
Plus 4.
plus what?
24.
24, sorry. But, Elizabeth Warren, I think, had, she came out and said, look, Teddy Roosevelt, bust them, trust busting. She's got to break them up. She hasn't articulated this fine level that we've gotten to here. We have to bust up these trusts because...
the history of trust busting. When Republicans were in power, they busted Democrat companies. When the Democrats were in power, they busted Republican companies. It's all very carefully laid out in this book, Tragedy and Hope, by Carol Quigley, who was, among others,
So
yes.
It seems to me that in the First Amendment, which you just raised, and in the 5G, and in the busting these AI and trained companies that are out, I think, at a systemic level to roll out the transhumanist agenda and robotize humanity, which is what they're doing in allopathic care at the Medicare level, right? So I want to pick your brains on this, because we're trying to develop the 5G strategy, and how do we develop a statute and then put that out there and say, hey, citizens, go to your city councils and get this enacted? How are we going to do this? So I'm going to turn this over to you guys, Charles and Ralph. How are we going to stop this behemoth? Over to you.
First of all, I would like to see Charlie Frohman run for president of the Libertarian Party candidate. That's what I'd like to see.
Sorry, could you say that again, please?
I would like to see Charles Frohman run for the presidency.
You took the words right out of my mouth. Charles Frohman has that. Charles Frohman, will you run for the presidency in 2020 as the Libertarian candidate?
I will accept any write-in that anyone wants to do.
Oh no, come on.
But, I do want to respond to your comment about libertarian saviors with a bit of realism, and that the Libertarian Party is more educative than anything else. It's a great way for a lot of regular folks to hear about liberty from candidates that are somehow sneaking through the smothering grid of the duopoly to give them a flavor of liberty and maybe open some minds. But it's not about winning. You do have some candidates that win locally, so you did mention mayors, and that's important. There's a pretty popular California local councilman, Jeff Hewitt, that is on a legitimate council of a pretty big county, so he had to do some pretty hard work to get elected as a libertarian. There have been state representatives over the decades, so it has happened, New Hampshire, Alaska, but that's the extent of it. You got to have sort of a Rand Paul running as a libertarian in the GOP to do some damage in a good way. Even with Trump, Ralph and I would defend Trump in some ways, in that, behind the scenes, some people we know in the administration, he's doing some damage with some pseudo hints that he'll do an oversight board over corrupt science at the CDC, or this conscience regulation that Ralph mentioned that now exists in law at the HHS department to restore and elevate your ability to use religion to protect yourself from coercion. But Ron Paul's favorite president was a Democrat, Grover Cleveland, governor veto of New York, former sheriff of Buffalo. So I would like to see a libertarian run in a Democrat primary, and carefully word his phrasing to placate whatever it is the progressives want, but get elected as a Democrat. Because the Democrat Party did arise as a libertarian party with Andrew Jackson in the 1820s, just as the Republican faction of Thomas Jefferson did arise as a libertarian counter-revolution against the international oligarchs of the Federalists. So, there's a great history for any method to liberty. This doesn't have to be just the LP, the Libertarian Party. But my suggestion is to go back to the 2008 coalition between the Wall Street occupiers and the Ron Paul revolutionaries. Yes. There you had progressive activists cooperating with libertarian activists to effect change however they could get it. And the answer to the 5G concern is just to repeal the 96 telecom law prohibition on using health as a way to block deployment. And to do what you mentioned earlier, there are local areas like, Mill something across the bay from San Francisco?
Mill Valley.
Just pass local resolutions to slow down the deployment. That's all you can do. It's got to be a local, step-by-step slowdown. You got that Connecticut senator, what's his name, calling publicly for legitimate testing.
Yeah.
But we haven't mentioned geoengineering. There are many threats to our health, not just 5G and not just toxic shots untested. There's a number of threats. So I think basic liberty solutions are going to get you your freedom and safety indirectly. Try to devolve as much stuff as we can from the feds to the states so we can easily influence politicians. Respect whistleblowers.
Now, the actual steps that I would take, since I think that the 5G system is a trespass. It trespasses on my property, including my body, which is my property. And it's a trespass that can be tested in court. So I think that under the old law of trespass, one has to raise those issues. Although the courts have never been willing to actually say that electromagnetic trespass is an assault, except in a very few cases where someone was like, being microwaved at you. I think it could be broadened. But the more direct thing would be, the very first step, Albert, is someone has to file a formal petition with the FDA at regulations.gov calling for FDA oversight under the rules that give them oversight over medical devices or devices that have medical effect. And you have to do that first, because in order to have standing to sue in federal court, you have to exhaust your administrative remedies. Probably a citizen's petition filed with the Federal Communications Commission would be a good step. They will, of course, either ignore it or deny it, but you have to go through that process before you can sue. It's called exhausting administrative remedies. And we've done that, by the way, in the vaccine issue. Back in March, we filed a citizen's petition calling on the FDA to suspend all vaccine drug approvals as illegal on the basis of that extraordinary case that Robert F. Kennedy Jr. Won last year. Last July, he made a Freedom of Information Act request to HHS asking for copies of the vaccine safety reports that the 1986 Childhood Vaccine Safety Act required on an annual basis. And then they had him law, and then he filed a lawsuit to support it. And then they finally sent him a letter saying, we've diligently searched our records and we can find no such reports. So Kennedy, being a smart lawyer, took that letter and and put it into a stipulation of dismissal of his Freedom of Information Act request. And so now there's a public record of the HHS saying that FDA has failed to issue a single one of the 30 annual reports that were required. And so we've asked the FDA to suspend all those approvals until they obey the law. We have to do that before we can sue.
Wow. Is there,
Yeah.
to your knowledge, who would you say nationally in the U.S. is really leading the issue in a way to stop 5G, or is that not? Is it really sort of a community that's doing it?
I've seen a lot of stuff on Facebook about 5G. I don't see any organization that's come out as a leading organization at this
Yeah,
point.
there is well. I mean,
Tell me about it.
I think you start with the overall progressive libertarian coalition
Right.
that we started in 2008 around the Occupy Wall Street movement, and then you bring in the subgroups that are focused on the issues. So for 5G, the group is the Environmental Health Trust. Theodore Scarrato, who was one of our guests on the Freedom Hub Working Group a while ago. And the same with every other issue with vaccines. You have the same sign of the Kennedy family, Robert F. Kennedy Jr., very progressive, and goes to the geoengineering issue, the fluoride issue, and every other issue. And you have to get everyone attending the same conference and just being open-minded to other issues. That your issue isn't the only one. 5G is not the only issue.
Right.
It's just a symptom of the control the cronies have over the government. They simply got a law passed, and you can't use health to block deployment.
Right.
It was a power play. And why they do it? Because they could. Why wouldn't you? If you had millions to earn, why wouldn't you screw over the populace to make some money? That's what the power does. It corrupts you. So it's about power and everything else, and so you have to do the hard work of coalition building.
I understand what. Yeah, I understand what you're saying. Now, let me just follow up with this question. I got into the 5G issue because I was invited onto a panel, and to be on the panel, I did some research and I produced a 20-minute presentation and video. And as part of that, I went onto a website called deagle.com, and they had some projections as to U.S. population, and the U.S. population there in 2016 was 324 million. And if you went out to 2025, their initial projection for the U.S. population was 64 million. And so that you had an enormous depopulation that occurred between 2016 and 2025. Now, we've been covering and we've been active in many areas that relate to the depopulation, ranging from Fukushima, ionizing radiation, chemtrails, GMOs, war, disease, crime, and poverty. The whole matrix and the depopulation programs that are imposed by various elites. We've had guests who've come on that have said they've had direct testimony, they've had direct conversations with the head of state security of a particular nation, who told them that there's a well-known plan to eliminate, quote, 4 billion humans over this coming period. And the coming period, there's an envelope that the period 2020 to 2025, that's like the window, they call it the, quote, ascension window. And this seemed to be congruent with that chart, which it had, the USA population 2016, 324 million. It went to its GDP to add all the statistics, and then you went out to 2025, population 64 million. And then, and it looked like, oh, that is congruent with the rollout of 5G starting in 2020, and it's a culling of the population, and it's congruent with the Georgia Guidestones. It's congruent with a lot of elite programs. A severe culling of the population. It's congruent with what they did to the Soviet Union and to a lot of these countries where the focus is, okay, it's time to bring down. The United States is the targeted country, as the Soviet Union was in the 1990s, as China was when they brought it down with Mao, who, by the way, was a project of Skull and Bones through Yale in China. There's a whole chapters of conspiracy research that proves that Skull and Bones, which is the second chapter of the Bavarian Illuminati, actually founded in 1776 to infiltrate the Declaration of Independence.
Skull and Bones was 1836.
No. That's the fake date. The fake date of Skull and Bones is 1832. The real date of Skull and Bones is that it was founded in 1776 as the second chapter of the Bavarian Illuminati. I know that because I'm a member of Torch and Talon, which is an underground secret society at Yale, and so the mission of Skull and Bones was to infiltrate the American Revolution and to bring it over to the Luciferian side, which is why it's a country that has been at war, and it's a country that now has 750 to 800 military bases around the world. It's the proconsul of the Dracos, basically.
The whole idea of the great culling is one that needs to be addressed. That phrase, the great culling, was first, I think, used by Dr. Rima Rabo in the early part of the 21st century. She tells the story that in 2002, she was treating a hereditary head of state in Europe. She won't tell us who it is. It's a patient. The patients have privacy. But this female royal was being treated by her, and they were having a discussion. And the woman said to her, my dear, it's almost time for the great culling to begin. And Rena, of course, her ears picked up when she heard that. She doesn't like being called my dear, so that really got her annoyed. But then she said, what do you mean? And the woman said, culling, C-U-L-L-I-N-G. And they said, well, I know what the word is. What do you mean? And she said, when all the useless eaters have to go. And she said, well, how many of these useless eaters? And the woman said, 90% of the population. We don't need them anymore. We're heading into and so Rita said, I said to the woman, your family's made a lot of money, selling lots of stuff to billions of people. How are you going to keep your wealth if they're gone? And she said, oh, you don't understand. We don't need them anymore. We only need 500 million people to maintain the technology for us. We don't need them anymore, so they have to go. And as Rita said, she said, this woman was totally insane, or I was being given an insight into something very important. And of course, it was insight into exactly what we're talking about.
Yeah.
Before he passed on, Dr. Lima's husband, Major General Bert Stubblebine, former head of U.S. Army Intelligence, the highest ranking member of the U.S. military to join the Oath Keepers, and also to come out and tell people that 9/11 was an inside job. But before Bert passed on, he wrote a series of essays and articles at Dr. Lima, truthreports.com, where he talked about the tipping point had been reached, and the American population was beginning to collapse. And the truth is, but for immigration, the collapse is very noticeable right now. And he showed from statistics that exactly what happened to Russian males in the 1980s and 90s, which was a population collapse, is beginning to happen to Americans. The white American males were becoming more and more susceptible to early death. And we now know, and was just announced a few months ago, if you were born before 1989, you have about a 17% chance of a chronic life-ending disease. If you're born after 1989, you have a 55% or 57% chance of having such a disease. So the tipping point has been reached. The baby boomer generation is living about as long as their parents, the greatest generation, but the generations after the baby boomers are having shorter and shorter and shorter lifespans. So you're absolutely correct. Statistically, the great culling has begun. And unless you take care of your health and listen to Charlie about how to pay for that, you're going to become one of those statistics. What did Stalin say? Kill a man and it's murder, kill a million and it's a statistic. And that's what we're seeing. We're seeing the statistics of death.
Yeah, and that was my introduction to 5G, because I said, well, why are they introducing this obviously harmful technology? I mean, why would they do this? What's the function? And if you look up Deagle.com, it's hidden in plain sight. And in 2016, U.S. population 324 million. 2025, U.S. population 64 million. Now, I don't know if that's suggestive, if that's foreshadowing, if that's a psyop, but with Loren Murray, who's a nuclear scientist, we did some programs looking at the impact of Fukushima, and we estimated using CDC data alone that after the first year, the U.S. lost 11 million people because of Fukushima radiation. And
I would love to see those statistics. I would like to provide them to Ambassador Murata.
yeah, I can send you that program.
We've had good relationship with him. Just got another emailing from him, and I post his emails on Open Source Truth. The whole purpose of
Fukushima, which was carried out by the Obama administration using the Stuxnet virus in conjunction with Israel, with the Israeli intelligence apparatus that's a false flag, and using one of the HARP facilities out of Sweden. In other words, it's a new world order depopulation operation. All of that is in furtherance of, quote, the culling. And that's what's been going on. And so part of our mission over the past, decade or more has been to track all of these culling operations, which are disguised as industrial accidents, but which aren't. And so I will send you the links to that program and article and the evidence and all of that.
I would really appreciate that. Thank you.
Yeah.
General Burt, back in 2011 or so, at the time of Fukushima, said he felt that the earthquake itself was a manufactured earthquake. And he had some evidence from the signature of the waves.
Exactly, it's what we call tectonic warfare.
Tectonic warfare. Got it.
Yeah.
Well, that's why, I stick with the tangible things that regular folks can do, because you mentioned possible psyop. There are so many theories to make the truth, pushed down from the top to distract us, distorts the truth. That's well, all we can do, I think, is support disruptive industries that restore power to the people, like what we're doing in healthcare. Coalesce with other activists who are trying to take back rights from those who have asserted power to the detriment of our rights. Expand whistleblower protections into the national security area so we can respect heroes within the bureaucracies that tell us the truth. Protect reporters who are doing true investigations of the truth, like Julian Assange, or Cheryl Atkinson. And then the dissidents, the mavericks who are trying to bring out the truth and support alternatives to Facebook. You mentioned breaking them up with antitrust. Antitrust has always been a tool of one set of powerful folks to screw their competitors.
Exactly.
Look at the history in the 1800s. It was local cattlemen and shippers trying to control freight prices, from the railroad charges. So it was just kind of big companies using government power to screw really big companies. And it's just sort of it's a symptom kind of power. It doesn't deal with root causes. So I like to, as a libertarian, focus on root causes, and whether it's in healthcare, empowering patients, they shop around, learn things, maybe get more natural, or just support the whistleblowers so they can tell us the truth. Devolve things to the states, break up the power within the government. I'm looking at indirect ways to go after all this crap that you're discussing. It's interesting, and some of it's true, but I'm more focused on the pedestrian activism that we can do, as well as commercial things from power people.
One thing people can do is not patronize YouTube and Facebook and that sort of thing. There's an alternative to Facebook. It's called Minds, MINDS.com. It is a blockchain-friendly, uncensored platform that you can join, and it works very similarly to Facebook. So Minds is one alternative, and there's an alternative to YouTube called Brighteon, BRIGHTBON, Brighteon, which I believe was founded by Mike Adams. These two platforms are ones that people should patronize and support, and they will give us the alternatives we need to be able to communicate, even if the crony corporate media get away with censoring speech.
Yamba, YAMBA. They're international already with 1 billion users, and they respect, I guess, Europeans' government protection of privacy, and that the censorship that's gone, they allow you to control the data and to monetize your creative content. So be on the lookout for that. So we're actually working with Yamba to help introduce them to our friends in the U.S. And that's actually going to be a major competitor to Facebook. You choose your contents, etc. So Yamba.
Right. Good. Well, we've actually, this time has flown by, and we've gone great in there, way in there into the normal 60 minutes. Are there points that you had wanted to raise that you haven't? And also, what would you like to leave our audience with, and how can they best reach you?
Okay, I'll go first. You can go to my website, vitaminconsultancy.com, or you can go to the Institute for Health Research website, which is inhere.org. INHERE, inhere.org. So you find that very useful. I'm happy to communicate with everyone. I also recommend going to opensourcetruth.com. Good articles there. I'm one of the administrators. Go ahead, Joe.
Thank you, Ralph. And I vouch for Ralph. Like I feel well vouch for Hillary Clinton, right? People are such a jerk. I thought he was endorsing her. He was defending her character because he worked with her. I'm not sure I would agree with his doctrine, but he did. The two websites for me are, if you want to join what I would characterize as an Atlas Shrugged Ayn Rand, just leave the health cartel, doctors, patients. We have a new site that's cleaner and kind of explains how we empower you as a patient. Yourfreedomhub.com. Go there, it'll prompt you to get contacted if you can learn more. Yourfreedomhub.com. Ralph and I will probably be doing a webinar on this health plan sometime this fall because we're all in this together. So commercially, you'll leave the big insurance, big pharma, big cartel system, join our sharing community, empower yourself, yourfreedomhub.com. Politically, every Wednesday afternoon, in an hour, in fact, so we host great speakers on every issue. 5G, informed consent, geoengineering is coming up, your basic tax and spend and regulation issues, more specific TSA harassment. So we're all over the map, but they all tie together. And there's a bit.ly to register for that, 4 Eastern, every Wednesday, bit.ly/all caps Freedom Hub Working Group. Join that hour webinar every Wednesday at 4 Eastern and meet the best leaders and the best issues that all tie together, and then join our horde, leaving the cartel for patient empowerment.
Excellent.
Great.
I love Freedom Hub. I've learned a lot from it. I try to get on it many weeks as I can. I think it's a really good area of information. Alan, thank you for giving us an opportunity to talk to people who follow your podcast, and that's about it, I guess.
Yeah, well,
and let me say, Alfred, thank you for all you do. People don't realize what an icon you are. I was trying to pick your brain a day or so ago, or a week ago, whenever we talked. You've got some pretty serious background, my friend. High-level lawyer for government agencies or committees. You should repeat what you've done over the years, like I got you to do with your health center experience. You deserve some credit for all those high-level places you've been to, which give you credibility for what you discussed in the podcast.
Well, thank you. And I really want to thank you both for what you do and for bringing to today the portal into a positive future that you have brought. I really feel personally just so much more energized after our program. I feel very positive. I feel very optimistic about the future because I know that individuals like you, individually and collectively, are really moving everything forward. And I'm sure that I'm looking forward to sharing this. And I know that people who come across this are going to be greatly have their sense of a positive future greatly enhanced. So thank you, and we look forward to your joining us in the future from time to time, because as the positive future unfolds, and you can go to our website, positivefuture.info, you can see that, oh yeah, we are biased toward the positive future. We'd like to get your comments and your insights as to how things are going and the directions that we should take. So thank you so much.
We'd love to come back whenever.
Great.
Yep. No.
Okay.
Thank you.
Thank you very much then. Okay.
Bye, everyone.
Bye-bye.
Bye-bye.